Hey everyone, Health Science 20, Mr. Maxwell here. We're going to talk about part 2, Health Science 20 Integumentary System. So we're going to pick it up where we left off in the last video, 3.3 part B, diseases and diagnostics. So diagnostics, that is diagnosing, okay, what's wrong, cures and treatments for diseases and disorders of the integumentary system. All right, so for lesions and infections, lesions are pretty easily diagnosed since they are generally external to the body, okay? So skin lesions, like we talked about, are external to the body, so pretty easy to see, to assess, and to diagnose. Also, infections are typically diagnosed just by observation as well, because if they are on the skin, they are on the surface, you can be able to see them, you can be able to touch them, and do whatever you need to do to examine and to diagnose infections as well. Sometimes a bacterial culture is taken to determine the exact infection if we're unsure. So a doctor may take a culture or like a swab. They might just kind of rub a Q-tip or something on your infection and then stick it in a tube or a bottle and then send it away. The lab will do some tests on it to decide, what kind of infection it is and how to best treat that. So when we're talking about cancer of the skin, obviously what we can do is be observant of our skin. That's a good way to notice if there's any cancer that could be developing on our skin, since our skin is kind of easily to observe. Moles are a big one. So moles are often checked for signs of cancer. And if you have a mole in your body, okay, so like I have a mole on my face, have it since I was a little kid. If you have a mole somewhere on your body, then you want to take a look at the ABCD approach. So it's an acronym. So A stands for asymmetry. So we studied prefixes, and A means kind of opposite of, right, or not, opposite, anti kind of thing. So if it's not symmetrical, that means if it's sort of lumpy on one side but not the other, or if it's shaped kind of oddly, not a nice round mole, that's not a good sign. That could be a sign that you might want to get checked out. Also, the B stands for border, so border irregularity. If it's around the mole there, if the border of it looks a little darker or not the same all the way around, that could be a red flag for you. The color should be even, okay? If it's different colors within a mole there that you can see, that's a flag. Diameter, okay, so the diameter should be less than 6 millimeters. If you take a look at your pinky fingernail, that's about 1 centimeter, so just a little over half of that. Also, you have a pencil, right? If you have a pencil there, the width of the pencil eraser is about 6 millimeters. So if you have a mole, like look at that eraser right there. If you have a mole bigger than that on your body, okay, it might be a sign that it needs to be checked out. And that eraser right there is, yeah, that's right on the border. Anything bigger than that, boy, you gotta get looked at. And then E, the last part of that, is evolving. If it changes over time, if it grows or just changes color, or the border or the color changes, asymmetry. If anything changes over time, it's like maybe something's growing in there. That could be a sign that you want to get that looked at, or even not even just looked at, but a sample of it taken and examined a little more carefully. That's called a biopsy. A biopsy can be done if observations are not enough to determine what's wrong. It's when a small sample is surgically removed in order to be analyzed. Many moles used to have biopsies done, but now doctors will most likely remove them if there's a concern. So moles now are pretty easy and safe to remove. So doctors might just say, you know what, we might get this checked out, but let's just get rid of it right now and not wait for a month or two and to see what comes back from the diagnosis. Let's just get rid of it, and you know what, if it's not cancerous, then fine, you got rid of it and it doesn't harm anything. But if it is cancerous, let's just get rid of it right now. So they might just go ahead and remove it. Still would probably do a biopsy though, just to see if cancer is present. All right, so burns, these can be diagnosed by observation since they are also external to the body. Most of the integumentary system issues are. I fixed this. Give me a second. All right, so get that picture out of the way for you. Burn severity is also dependent on how much of the body is burned. A greater area is typically more severe, okay? Just again, more of your organ that's being damaged. This is accessed using the rule of, or assessed. That should be assessed. Accessed? That should be assessed. This is assessed using the rule of nines. The body is divided into sections, each with 9% of the skin surface area. So if you take a look at your head and neck, that's about 9%. Your arm, okay, so each arm here is about 9%. The front of each leg is 9%, and the back of each leg is 9%. So each leg in total is 18%, two sections of 9. The front of the torso is 18%, the back of the torso is 18. So your lower back and all that sort of stuff. All right, your genitalia is about 1%, and what isn't on this list here is the chest and upper back. So the chest is 9%, upper back is 9%. So on the diagram's good. Head and neck is 9, this is 9, this is 9, and the back side of this is 9, back side of this is 9. Each of these are 18. So if you have another 18, I think you've got, actually I think we're a little less than 100% here still. This is not really exact. So 4 9s are 36, 2 18s are 36. So that's 72, 73 with the genitalia there. And then, so what's that? That's 28, 27, 28. So yeah, so the chest and upper back gonna be a little more than 9% each. So anyways, for my quick calculations, this is not up to 100%. So anyways, I might have to double check that, but that's what was given in the textbook. So correct me if I'm wrong. Maybe you can send me a message here if something doesn't look quite right here. Oh, the legs, front of each leg, back of each leg. Oh, and we got add another 18% because this is just one leg. Yeah, okay. So that's 1 2 3 4 5 6 9s. Okay, 6 times 9 is 54, and then 36 is 80, that's 90. And then chest and upper back is 9%, and then 10, 100%. Okay, so we only have one leg counted here. Anyways, the rule of nines, roughly 9% each of those sections, but not listed here was the second leg, and the chest and upper back is not listed here either. So, all right. Let's move on. Disease treatments, diagnostics, cures, and treatments for these diseases. Okay, so for lesions are typically just cleaned, disinfected, bandaged, allow for them to heal. So generally not removed unless they are deemed to be cancerous. Some kinds of lesion need to be drained first. There's sometimes a lot of fluid in the area. Sometimes they need to be drained before they are cleaned and able to heal on their own. Infections, if you have an infection on your skin, if they're caused by bacteria, you can get antibiotics for that. So antibiotics are only used if it's a bacterial infection. Most infections can be fought off just over time by the body if they are viral. So a viral infection, antibiotics don't work, like penicillin, any kind of penicillin product like amoxicillin or that kind of thing. So if you go to the doctor and you have a cough, or you're just feeling really bad, a cough is part of it, he might listen to your chest and say, you know what, I don't hear anything in there, your chest is pretty clear, I don't think you have an infection, I think it's just viral, go home and take lots of fluids and rest a lot and let your body fight it off. But if the doctor happens to hear something in your chest, like, you know, put the stethoscope on you, take your big breaths, if there's like crackling or if there's something, if it's noisy in there, then they may say, yeah, you know what, sounds like there's clumps of infection inside your lungs, and that's probably bacterial. And so that's, I'm going to give you some antibiotics to try and fight that off. So that's the difference there. Sometimes you get antibiotics and sometimes you don't. It just depends on the type of infection. So often symptoms are treated, but the best course of action for most diseases is, of course, prevention. So prevention is most commonly achieved through vaccination. And for the society as a whole, the more people that get vaccinated and don't get infected or don't get these diseases, fewer people will be infected. When we're talking about skin health, the sun is a big thing. So if you go out and you're not wearing sunscreen, or you're not wearing long sleeve shirts, and if you're tanning a lot or getting burnt a lot, you could be damaging your skin and inviting infections and even even cancer of the skin through overexposure to the sun. Canada achieved virtually measles elimination status in 1998, but anti-vaccine movements and fewer people getting vaccinated for certain things like measles has increased that risk again. So measles looks like it might be making a comeback again, and being a risk of being passed around here in Canada again. So vaccination is important. Some people feel differently about vaccinations. Certainly there are side effects as well, and the measles, mumps, rubella is a pretty typical vaccination that we have here in Canada for our infants, and so the measles is in that, and that's been pretty effective for many decades. All right, we're talking about cancer here. If you have cancer, a lesion on the skin could be cancerous, and there is, you can surgically remove it from your skin, literally just cut it out and take it off. If it's too deep, you might not be able to get all of it without going too deep and destroying your flesh or tissue, muscles, and that kind of thing. So sometimes they try and remove a lot of it. Sometimes they accompany also surgery with something called chemotherapy or radiation. Chemotherapy is trying to kill the cancer cells using chemicals. So chemicals that you take, and your cancer cells love that kind of chemical, and they just eat it, and it kills them. And so that's the idea, is that it's chemical substance that kills the cells. Radiation is literally low doses of radiation that's focused on the cells to zap them and to kill them. And then of course surgical removal, if it's not in your body to multiply anymore, then sometimes that works too. So if the doctor says we did surgery and I think we got it all. Okay, when they say that when they're doing cancer surgery, they think they got all of the cancerous tissue. They got everything there and immediately surrounding that area, and they think that all the cancerous tissue is gone, and then it's kind of like a do-over. You start over, and hopefully your body just creates normal healthy cells again. Sometimes the cancer comes back. Maybe they didn't get it all the first time, or maybe just whatever caused the cancer in the first place is causing other cells to be cancerous. So I don't really know too much. We're not going to talk too much about Mohs surgery, but basically if you take off much of the cancerous area, if you don't get it all, if the doctors aren't confident that they got it all with surgery, they could also put the patients on accompanying chemotherapy or radiation. So burns, treating a burn, depends on the type of burn. The first rule is to stop the burning. So if you have anything burning your skin or a chemical that's on there, you need to wash it off or remove the burning. Cool the skin down with cool running water if possible. So don't use butter or oils or peanut butter or anything like that. Just cool water is good. Cool the skin down, and try and flush off whatever might have been irritating or burning the skin if possible. A first-degree burn simply needs to be cooled down, then bandaged with clean, loose gauze. I'm not sure if you are familiar with this word gauze, but it's kind of like a cloth material that's meshed. There's holes in it, and it's very absorbent, but it also lets a little bit of air through to allow the wound to heal. Okay. A second-degree burn. Remember, if it gets below the surface of the skin there. A second degree, if less than 9% of the body is burnt, then it can be treated the same as a first degree burn. And if there are any blisters, if you do have a second degree burn, it seems to penetrate the second into the dermis, not just the epidermis, but if it goes deeper and you do have a blister forming, don't pop the blister. You pop the blister, there's a chance for entry of infection into your body. That's the big thing. So you just let the fluid kind of do its work. It'll dissipate and go away, but try not to pop the blister. Third degree burns are typically requires a skin graft. So again, if it goes deeper, it destroys the skin. We'll talk a little bit more about skin graft in a few minutes, but basically you take skin from a different part of your body and cut it out of your leg or something like that, where it's unseen and where you have maybe a little bit of extra skin, and put it on your face or on your arm or wherever the bad burn is. If it's less than 1% of your body, then it can be done. If it's a little bit more serious. Fourth degree burn, remember that gets right down to the bone. Burns up all the nerves and the muscle and right down to the bone, probably going to require amputation, which is a cutting off of the limb. So if it's on your arm, if it's a 4th degree burn, like your arm, it's burnt all the way through, like you just have bone, and even the bone is burnt, and so it might require amputation. Unfortunately, you don't want infection to take over, you know, that part of your body or the rest of your body and potentially kill you. So unfortunately, amputation is a option there. Skin grafts. Okay, let's talk a little bit more about that. This removes a layer of skin from a donor site in the body to be placed over top of the burned portion of the body. So the first thing you do is for skin grafts, you prepare the burn site. This means removing any damaged tissue and preparing a bleeding surface. This is called debriding. Okay, so you kind of make it a kind of a bloody sort of damaged tissue-free surface area. The doctor then uses a tool called a dermatome to remove a layer of skin from a donor site wherever somewhere else in the body. So you basically skim off some skin from your leg or from another part of the body. The skin is typically run through a device that meshes it, so basically pokes little holes in it, and the skin is placed over the damaged spot and stuck right on. The meshing allows air to get through and more blood flow, more surface area for the blood to flow and to heal and to start growing new skin cells. It's attached to the wound and sutured into place. So sutures are stitches. So it's literally sewn on to you, and hopefully the body, you know, accepts your own skin and begins to nourish it, and it begins to be just acts like the rest of your skin. Is the idea. Often special healing technique called vacuum assisted closure, VAC, is done for the week following surgery. It's basically a vacuum on the area. It sucks out infectious fluids. It also brings more blood to the surface to promote the fast healing. If there's not enough donor skin, artificial skin will be used. We're not talking about plastic or rubber. It's talking mainly about animal cells. So try to trick the body into producing new regular skin cells. And so the donor cells, artificial, would be some animal skin cells. So you can kind of see there at the bottom of this skin graft diagram, there's sort of an area there that's been placed on top, and sometimes the skin comes with the hair follicles. If the roots are not damaged, the hair will keep growing as long as the body can accepts the skin and it can nourish it properly. All right, so let's talk about careers, last section here. So the integumentary system can be treated and examined by any medical profession, but there are 3 professions that focus on this system more than others. Allergists, that concern themselves with allergies, allergens. Dermatologists, you remember dermat is skin, and ology is a study of, so study and application of skin procedures. And plastic surgeons, so they call them plastic surgeons. They don't really deal with plastic, but they do lots of skin grafts and reconstruction of skin. So allergists are doctors specialized in the diagnosis and treatment of asthma and other allergic reactions. Dermatologists, they specialize in treating skin, hair, nails, and mucous membranes. They work closely with plastic surgeons, and plastic surgeons reconstruct body tissues so that they minimize the evidence of surgery or trauma. Many plastic surgeons are also dermatologists or work closely with them due to the heavy use of skin grafts in plastic surgery. And that is the end of the notes section. So hopefully you've been able to fill out all of the spaces in your notes there. You can review any part of this video to fill in anything that you might have missed. And yeah, I'll see you in class. Bye.